Hello, everyone. My name is Patrick Platone. I'm our head of marketing here at NEER, and I wanted to welcome you to another webinar that we are hosting. I'm going to keep this short because you're definitely not here for me. Here's the thing that most people get wrong about cosmetic dentistry. They think the beautiful smile makeovers, the no prep veneers, the high-end aesthetic work, all of that lives in some boutique studio with a single owner and total clinical freedom. And if you're a GP inside of group practice or a DSO, the assumption is that cosmetic is somewhere between hard or even impossible. Our guest today is living proof that that's not true. Dr. Bianca Velayo is a hardworking GP. She practices inside a group structure. She also owns Green Valley Smiles and she co owns multiple practices in Las Vegas. She's built a thriving cosmetic line without rebuilding her practice model to do it. She's been featured in Dental Economics, Inside Dentistry, ADA News, and she mentors GPs across the country exactly on this. And I think that's about as much hype as I can give, Dr. Bianca. If you want to take it away here, welcome everyone.
Thank you so much, Patrick. Thanks, everyone. It's such an honor to be here. Always excited to share something that I'm super passionate about. And I mean, Patrick hit the nail on the head. I think, I graduated from Tufts University in 2011, and I didn't want to specialize. I was super excited to be a general dentist. I love that I'm able to do any procedure that I want. I love having all those different tools in my tool belt. I love hygiene, the mouth body connection. I love helping emergency patients. So when they come in, I can figure it out. If they need an extraction or a root canal, I can do all those things. And so when I thought about cosmetic dentistry, I pictured, like a Miami, Beverly Hills, fancy lights, or a doctor that only does veneers and has 500,000 Instagram followers. And I'm so happy that I just continue to just do what I felt was right and treat the needs of my patients. And, I am not a boutique cosmetic dentist. I am partnered with PDS Health. I still have a very thriving GP day. I have hygiene, same day treatment, fillings, crowns, GP aligners, and everything in between. And, I do believe that cosmetic dentistry has a place in everyone's practice, and the patients are everywhere. Patients want nicer smiles. Thankfully, because of Instagram and all the selfies, we all see ourselves and we want whiter, brighter, straighter teeth. And you know what? I truly believe those patients are in your practice waiting for you to start that case. And so throughout my career, I've had patients wanting straighter, whiter teeth. And so, we've already done, if they've already had restorations, I felt comfortable doing veneers or crowns. I had Invisalign, I have whitening in my tool belt, and I've tried composite veneers and just no, okay? I mean, why spend so many hours doing something that was just like, it's not as cute, takes so much time, not even worth it, in my opinion. And so we know, I feel like up until this point, if you think cosmetic dentistry, it's always going to be porcelain. And so there is this weird gap in my toolbox. And thankfully, NEER became the answer to that gap. Oh, literally, look at that diastema. NEER became the answer to filling that gap. Man, I'm so funny. All right. So raise your hand. Obviously, I mean, I always teach in little classrooms, but let me know if you agree. If you're part of that NEER WhatsApp group, if you aren't, we'll send you the link. You should join. It's hundreds of doctors sharing cases. And so if you've looked in that group or go to your cosmetic dentistry Facebook page or whatever it is, and you immediately felt inadequate, okay, I'm telling you, that's me too. I mean, you see these incredible cases and you think, I could never do that, right? But again, this is my first patient. This is my assistant manager. Her name is Demi. She was knocking on my door and she says, Doc, I really want veneers. Her teeth were beautiful, straight, big, but she couldn't whiten. They were just that natural color, and so long I had to say no. And so again, I thought maybe this like super crazy high-end cosmetic dentistry wasn't for me. And when I first learned about NEER, I was like, this is my first case. Okay. And I'm here to share with you because I think it's all important for us to remember that my first case wasn't Instagram worthy. Okay. My first case was educational, and we all have to start somewhere. Okay. And so my best advice is find that patient that you trust, that's comfortable, yeah, easygoing, easy case. Okay. And that's, I learned a lot. Okay. Because your first case, we want it to be a slam dunk, but the reality is we're going to learn a lot of lessons. Okay. And so, and this is some of the lessons that I've learned that I'm going to share with you today. I mean, this is my first case coming back. I did not like the margins. It didn't fit all the way. We could even see on the lingual of that canine. I'm like, oh, it's not wrapped around perfectly. So I learned a lot of different things. Okay. Like how to better evaluate the smile. Look at this. Now that I'm 10 plus cases in, I can't unsee what I see. See those arrows on the right? That represents, look at a bulbous canine. That's creating an undercut. So then the NEER could not sit properly. And so what I ended up doing is a little bit of polishing or select minimal enamelplasty in the area to flatten the canine. Therefore, then the NEER could sit more fleshly and I can get better margins. Okay. I also learned that I should probably look at these case proposals better, right? The first time you submit your case, you take the photos, the lab sends you a design, and I'm like, oh my God, I'm so distracted by how pretty it looks. I forgot to look at the interproximals, the margins. So I learned all those things. Okay. And so, I'm really big, and I'm really always excited to be here to share my story because I'm always big on transparency, honesty, not about perfectionism. Because again, I know we all come from the age of Instagram and the highlight reel, but when it comes to dentistry, I think we all benefit when we can really, take it down, take back some of the flash and just be like, hey, this is what I'm seeing. These are the struggles. That's how we can learn and grow and advance together. So, and so I share this, those black lines, especially we could see like 7 and 10, they're a little bit rotated again, therefore making the material maybe bulky in that area. So now that I see it, I'm like, okay, let me do the selective enamelplasty. Let me get those teeth more flush and aligned to that more ideal arch form. The tiniest little bit that I touched that tooth allowed now a more uniform thickness of veneer, easier seating, and easier delivery. And I always love to highlight at the beginning too, again, talking about how I'm not a Beverly Hills dentist. And, I am very proud. I don't of the practice that I've built. Patrick's been there. He knows. He says, I really love the vibe of your practice. It's great. We do great dentistry. Okay. And I also believe that sometimes it's not all about the bells and whistles. It's the patient care and the quality of the materials. And so I like to just share that all these photos are shot on my iPhone. Okay. Just because, again, I always like to sort of break it down and eliminate some of those barriers that we think we need the perfect patient. We think we need the perfect setup. We think we need to wait until I've done XYZCE. Sometimes it's just about getting started, learning from that experience, and then knowing that case 2 is already going to be better. Okay. And so these are the afters. I had to submit a revision twice. I'm not going to lie. But also, this was, almost a year ago when NEER was just getting started. I will say what's so cool is that working with a company as innovative as NEER, like the designers, the whole team, they listen to your feedback, they listen to the critiques. They're constantly evolving to provide a better product. And, patient so happy. Now she is my walking billboard. So that's my other tidbit I love to share with you. You need to do cases, and every case is going to serve as marketing, experience, learning, the billboard to set up and get your next case. Okay, so that was a really long intro, but by the end of this, you're going to identify the right case. I'm going to walk you through real cases from start to finish. We're going to go over the bonding protocol because that is something that you have to nail if you want to have success. Learn the patient, the ways that I can close my cases. That way you can start doing your first 1, 2, 3, 4, 5, 10 cases. Okay. So if you're new to the game, NEER is a porcelain hybrid 3D design printed veneer. It's about 70% porcelain. It's about half the cost of traditional veneers. And the advantage of 3D printing is that it actually allows extreme precision. We're not milling it, so we're not limited by the burr diameter. And again, if bonded properly, it's super strong. 140 to 160 megapascals for my dental nerds. Okay. And so how many more cases would you start tomorrow if you knew you did not even have to pick up a handpiece? Okay. It's this is designed to help you be like painless, okay? Painless for the patient, easy for you. And so again, talking about that void in my tool belt, like it was like porcelain veneers or nothing, because I really stopped doing composite veneers years ago because I was like, this sucks. And so thankful now we can offer this for patients who maybe financially can't support or not ready for those. I really do view, you know, porcelain's never going away. Okay. Like, let me just say that porcelain is still going to be the tops. But like, I like to think of NEER as it's bridging the gap, and it's opening the doors for more dentistry to be done. Okay. And so this is additive, it's for patients who are afraid of shaving their teeth, because we're really seeing a whole pendulum shift now due to all the Instagram and TikTok videos of people seeing like their teeth being shaved down to nubs. Now they're like, I don't want my teeth to be shaved down to nubs. Yeah, you're 20 years old. I want you to save as much of your enamel as possible. Okay. And so it's really psychology driven, because now people are like, I like it. It's safe. We could remove the veneers afterwards and you'll still have all the teeth underneath. And, to some patients, it feels like more low risk as well. We're not lowering the standards. I really want to make sure that I emphasize that like the most. We're just widening access. It's not either or, it's really just expanding the menu because patients want options. And so for me, as I mentioned, I am part of a big group practice. I have 20 plus people that work for me. I have 5 practices in Las Vegas. I'm busy. I see 12 patients a day. And I think most dentists have it backwards. I think we think like group practice, maybe we're limited that we can't do cosmetic dentistry, but I truly believe that we have some built-in advantages that maybe smaller practices spent years trying to build. Like we have an existing patient flow. I see over 300 recurring recare patients monthly. Like I don't have to find those patients. The patients are already in the chair, and then we can build that relationship with the hygienist, right? The hygienists are seeing them 3, 6 months, and they're the ones, they're listening. They're like, oh, I hate this gap. I wish my teeth were whiter. Oh, they see the advertisements because I have marketing brochures everywhere. So then they're going to start, it's not just hygiene talk. Now it's cosmetic interest. And I do believe cosmetic dentistry is a team sport, right? So, I told you, Demi, my assistant manager, she's in the front. She's smiling. People want her teeth. Guess what? She inspired then my next front office receptionist to get her NEERs done. She's like, I can't be sitting next to Demi and my teeth look like this. Now they're just smiling to everyone. And they're like, I want my teeth to look like that. And so now everyone's telling their story. Everyone's hyped up. And they can start determining like, okay, if their teeth are relatively straight, don't have much dental work that needs to be done, are they going to be a good NEER candidate, right? The whole team already is starting to become aware of what to look for. The other thing I really, really want to point out as well is that this isn't, it is just being mindful. I told you, I have a very busy practice. It's just once you start doing these cases, you need to just start scheduling appropriately. And that's, again, where the whole team comes involved. So, the beauty is that when you do these big cosmetic cases, like that's your day's worth of production. So it's okay if you block out your schedule. So it's scheduling smarter. And again, when I'm doing cosmetic, like I want to make sure that I'm locked in, that patient's getting my attention. I'm not rushed. I'm not running to see a different patient. So it's just that communication. We block the schedule so I can do the procedure. And as you see, as we move forward, like the process is super simple. So like scanning for NEER takes 30, like that once we're done consulting and the patient's already a yes, my assistant scans, I take a photo. That appointment is like less than 30 minutes. The longest part that you're going to need to block out your schedule for is just the cementation. And in the beginning, I always like to block out at least 2 hours uninterrupted, especially because like cementing 10 anything, whether it's porcelain or the NEER, takes time. And so again, that's the only time. And so one of like I don't know how your offices run, but for me, one of like the best tricks that I've learned is that I always split the production. Okay, so I reserve a little bit of production for the cementation, because as much as I get so excited to charge out the production, like, let's say I'm doing like a $7,000 near case, as much as I'm tempted to charge out that $7,000 of production for the day that I scan, I know that I'm kicking myself in the butt, because 2 weeks later, when I'm coming for delivery and I just blocked out 2 hours of $0, like, that's a shame on me. So just communicate with your front office, and how you want to do that. But that, at least for me, makes sense. And because when it comes to the nears, remember, it's prep list. You're barely doing anything on that first visit. Most of the work is just going to be cementation, adjustment, occlusion, polishing, all that stuff. Most of the work is going to come in during the cementation. So it's good to feel like at least you've made some money for that appointment. So that's one of my little tricks over there. Um, Financing, okay, big one. One of the perks of working in a big group practice DSO, we like, patients don't say no because they like hate their future smile. They're just trying to figure out how to pay for it. And like, we already have so many financial systems in place. So I know financiers are never the reason patients can't get the treatment they need, because we have payment plans, care credit, whatever it is. So let them utilize that so you can get more case acceptance. I'm part of PDS Health. We're very into high tech. I've already been scanning, already used to a digital workflow. So the infrastructure is already there. So honestly, I mean, like I said, the opportunity is already there in your practice. And I really want you to feel like you're enhanced by your group practice setting to do this, rather than like, oh man, this isn't possible for me. So, finding the right patient, most important. As I already called out, if you're not part of the NEER WhatsApp Clinical Lounge, do it. You get to learn from top dentists. We're all idea sharing, going over cases. And the best advice that I have for you is just pick a simple case, okay? Like, you want cases that build your confidence, not destroy your nervous system. We know those headache patients, we know those complex cases. I'm seeing so many cases being sent on group chat that are like bruxers, severely worn down, severely rotated. And they're like, hey, can I do near? And I'm like, I mean, I guess you could, but like, why would you? Why give yourself that headache? Like, the next question I say too is like, would you do it in porcelain? Would you do like a conservative min prepless porcelain on that case? If not, the answer is still no for near. Like, some of these patients truly need full mouth rehab, opening up the bite, full coverage, bite deprogramming, whatever that is. So, let's just start with some of those easy cases, okay? Um, you know, like, another couple things I really just want to point out as well. Near is additive. We are adding. So if they already have big teeth, well, then they're going to have bigger teeth. If they already have long teeth, well, a near is going to make the teeth longer. If their teeth are already protruded and flared, well, then their teeth are going to be even more pronounced and protruded and flared. So I just want you to imagine that. And the good news is, if you can't imagine that, then we have a tool for you. It's called Moment. Moment is a try-on smile where you get to actually like test drive what the nears would look like before anyone commits. So I think that's the best tool in your tool belt. We'll talk about that in just a little bit. But so short teeth, small diastemas. And so, we always want to visualize what is the ideal arch form. Okay. If a tooth is very deviated, like more than half a millimeter deviated, either rotated, flared, out of position, recessed, about half a millimeter or more from the ideal arch form, I'd consider that more of like moderate or red flag. And at that point, you're probably going to need to do you have to ask yourself and your patient, wherever that most prominent or like protruding tooth is, are we okay if all the nears meet that point, right? Everything's going to be additive. If you think it's going to be too bulky, then you're going to have to do some sort of reduction to try to get everything looking less bulky. Okay. And so questions that I like to ask during my exams are, I think we spend too much being like super complex about like materials, prep designs, like really we have to have a conversation. We need to decide if the patient like wants a better smile. Truly the conversation is going to be emotional. Okay, so most cosmetic consults are like not about dentistry, it's about listening. Okay, so you got to ask questions. What do they like? Okay, we're not trying to convince anyone to do treatment, we're trying to help show them what's possible and help them decide if it's worth it. Okay, and then we can always say like, that's why I want to start with the most conservative option. These aren't crowns. We're adding to your teeth, not cutting them back. It's an enhancement, not a reconstruction. And I can get you the result you want while preserving your tooth structure. So I love to ask open-ended questions. What bothers you most about your smile? What could you change about your smile? Do you want a bigger, broader, wider, like filling in the buccal corridor, wider smile or whiter smile, right? Um, and so what's really nice in my practice too, like we have a really robust patient intake form, and it already asks like, do you want straighter, whiter teeth? And so I not only, I ask these same types of questions for my patients, those hygiene checks, those recare patients, right? So I love it when a patient comes in and they don't have any cavities, and I say, hey, good news, you don't have any cavities. You're ready to talk about cosmetics. It says here in your chart you want some whiter, straighter teeth. Have you thought about, we have options. I'm happy to, I'd love to take some photos of you and show you what's possible, right? If you have any smile simulator programs, that's really awesome, or the moment. And so again, you don't have to strictly advertise for cosmetic. It's just really paying attention to the patients that are already in your chair, or for those patients that have already completed their big treatment plans, or for the patients, who are doing Invisalign. All right, Invisalign, then right afterwards, you can tie in, okay, now that we've gotten your teeth straight, those patients are the pickiest. They have maybe black triangles, maybe their incisal edges aren't perfect. They're now like staring at their teeth that's not white enough. And you can say, okay, like you're a really great candidate to do prepless veneers. Okay, if you want that whiter, brighter, bolder smile. Okay, so people really love the conservative aspect. And again, I always like to lean on conservative. We're not drilling your teeth. We're adding a conservative layer to improve the shape, the color, the overall appearance of your smile. It's not aggressive. And so actually, this is a really great example. You can see on the left, that patient just finished her Invisalign. She has her button. She has a black triangle, and so the edges were all uneven. And so she spent all this time trying to perfect, and now we're like, okay, let's put the cherry on top and let's truly perfect. You can see on that bottom right, like half near, half not. Pretty bold. And honestly, this was just the try-in after cementation. What's super cool is that you can like reshape, take down, adjust the occlusion. And so especially if the patient feels like it's too bulky. So okay. All right, so this is really fun. We're going to do a full case review. So this is one of my patients. Her name's Rachel, and we did try Invisalign. We tried Invisalign for a couple years. She fell off the face of the earth. She's like, I'm not compliant. And then she was like, I just can't do this anymore. And she's like, I just really hate like that tooth number 7. It's pushed back, it's recessed. I want some whiter teeth, but I don't want it to look too fake white. And I was like, hey, I mean, if you're telling me you really can't, like, you're not compliant, you're not doing these veneers, we're doing your ortho, well, then let's do the prepless veneers. She already had a pretty decent bite. Looking at the overjet, looking at the smile line. Does she have any existing restorations? No. What's her shade goals? And patient expectations. I cannot harp on this enough, but you need to make sure you set expectations super, super, super clear and let her know everything's going to be additive, and there we go. So as it's my standard operating procedure, I do a moment now on any cosmetic patient. And whether they're considering NEER or not. And so, this is what a moment is, right? It's a try on, snap on smile. Okay. And it's not just about the material, it's about the emotion. The patient sees themselves differently. And one thing I really want to point out here, right? I didn't just like zoom in on her teeth, I showed the full face because patients like really need to see the difference. It's not just about like nitpicking every tooth. It's like, wow, I have so much more symmetry. My teeth are whiter. And now it's a decision for them. And they say yes. Okay. And so Moment is $125, or you can get a 5-pack for $500. Patients can take it home, but really most of the time right there and then they're like, all right, let's do it. Let's start it, because they feel that emotional buy-in. And I love it. Again, for you, especially if you're new, another trick that I love to do is like, if I don't know where to go, and this is what I tell my associates to do, okay, do the NEER, take a bunch of photos, tell her we're going to consult with the designers, and then we'll bring you back to do the final scans. That way, then we can determine, do we need to do any enamelplasty, any reduction, any questions that we need to prep for? So this at least buys you time while you're doing, before you like, do the real deal. And so then we scanned. Okay. And so for her, we did do a little bit of enamelplasty, and I'll show you in just a second. But because when you take off the Moment, you're going to be able to look at it in the light, and you'll be able to see where's the bulky areas, where's the thin areas. And so if it's thin, that means the tooth is too rotated or protruding in that area. And so you might want to do a little bit selective enamelplasty in that area. So this is what I tell the patient. Okay. And I know the idea is NEER is prep less or no prep, right? Like that means we're not touching the tooth. But a lot of us doctors who've been doing this, like we do oftentimes some enamelplasty if needed. And we tell the patients, like, I'm just going to polish the teeth so the veneers seat better. It's going to help it turn the case from an 8 to a 10, type of situation. It's gonna take it from good to great. And I think when you explain it to like that to the patient, they're like, yeah, do whatever you got to do. I don't have to numb you. I don't have to, I don't even say drilling, because it's like, I'm not. It's, even though we do take like maybe a red flame or a shofu disc. And again, to me, this is less than 0.5 millimeter. The most common places that you're going to see that you're going to do it is the distal of the centrals, the like facial prominence of the canines, like I showed you earlier. I like to roll in the facial line angles to prevent fractures. So anyway, this is, something that you might need to have in your tool belt. Okay, so going back to Rachel, so those black lines represent the places that I did do a little bit of enamelplasty. So you could see the before on the left and the after on the right, okay? And so I just evened out the incisal edges. Number 6 is bulky. You could see that, right? It's like forward, and so I just flattened it a little bit. And you can see after just a little bit of enamelplasty, like the teeth already look better, right? Like, because we're trying to get it straighter, flatter. The straighter, flatter that they are, the easier that the veneers are going to sit. So, and she was super chill, and she was a great case. Okay, so I scanned. One other thing I like to do is I love using Traxident. So I did my final scans. Traxident is like a gingival retraction and hemostatic agent. I just want my scans to be super clean. I use a prime scan. And so then I scanned it. I take my photos. I sent it to the lab, and I get it back. Okay. Not a sexy part of the lecture, but very important, the bonding protocol, okay? So we're going to spend a little bit of time here. The most important part is that you follow all these steps, okay? I would say I think a lot of the doctors are using Variolink. That's what I do. I use Variolink LC like Cure. Again, I mean, if you're a pro, you've been doing this, but I really think that this has been the most research and most used bonding protocol. And this is the one that we're go by, because if you don't follow the steps, and like, how can you expect to have the most predictable outcome? Okay, I am going to go step by step just because I want to make sure we really get it. You do need to aerobraid or sandblast the tooth. Okay, we're going to backtrack. We got the NEERs in. We tried them in. So let's actually start there. Delivery day checklist. Before cementation, patient approves the aesthetics. We check the midline, contacts are checked. Sometimes you have to adjust the contacts. It is what it is. Margins are checked, shade is accepted, photos are taken, consent is signed. Okay? All right, approved. Now, we're going to now clean the veneers, okay? So we're gonna, actually, I think we should start cleaning the veneers first. We clean the veneer, we sandblast the veneer for 10 seconds, rinse, dry. Monobond plus, okay? Dry, okay? Then Adhese Universal. Adhese Universal is the paired matching bonding agent for Variolink. Okay, so depending on which cement you use, but again, I highly recommend you use this one. So you're going to use Adhese Universal. So you're going to use Adhese Universal inside the intaglio of the veneer, no light cure. Okay, and at that point, then you can actually coat everything with cement and then you can put it in like a dark box until you're ready to go. Okay, like that's actually one of the things because like you try to like load everything one by one, it just takes forever and then you're just really stressed. So like I like to preload it. That's great. Okay, we've done that on the intaglio of the veneer. Now we're going to prepare the tooth. We clean the tooth. You can either air braid the tooth, pumice the tooth. Then you're going to selective enamel etch. Okay, rinse, dry. Again, you're going to use your Adhese Universal on the tooth. You're going to air thin, air thin until you don't see any more of the bonding agent like moving on the tooth anymore. Okay, you're going to light cure this. Okay, then you're going to gently place the veneers on the teeth. Okay, I always start with 8 and 9. Okay, 8, 9, 7, 10, 6, 11, 5, 4, 12, 13. Okay, that's what I like to do. I always start with the beginning. If you're a newbie, and me too, or it's like a complicated patient, all this stuff, sometimes I'll do like the front 4, front 6, and then I'll do premolar and then premolar, just because if like the patient's moving a lot or hard to isolate. Even though like I would say use an Optogate, make sure that it's super, super, super dry. Okay, after you've got everything gently placed, clean up the excess, spot tack cure. Spot tack cure, like 1-2 seconds, then take your whatever you like to use. I use an Explorer. I use a Montana Jack scaler. Start cleaning everything off. I carefully floss. You're going to floss down, pull through. Do not floss up. If for any reason you get a bleed, if it starts bleeding, have your assistant start light cure that, okay? Because we don't want to get any blood underneath, okay? And then it just stinks. It's going to be harder to clean afterwards. But those Sari Saw white IPRs become your best friend, or like an interproximal sanding strip become your best friend. After everything's fully cured, then you're going to check the occlusion, adjust, and then polish. So yeah, I think that's it. What other tips do I have? Other tips that I have for bonding. I do 2 of everything. So I have 2 blue etches because we're doing 10. So I have my assistant do the left side blue etch, and then I'll do the right side 5 teeth. We meet in the middle, then we rinse, dry. Then I start bonding. She has bond. We're bonding, and until we meet in the middle, then we have 2 light cures. It just makes the whole process go so much faster. So if you have the luxury of having 2 of everything, do it. So yeah, bonding protocol. There is a video. NEER has so many great resources on YouTube, so please check out the YouTube. It's a 5-minute video with Dr. Brian Harris. Amazing, super simple. It highlights this as well, just if you forget. Okay, cool. All right, so we did all those steps. And then here, ta-da, befores and afters. And so she was super happy, okay? Chill patient, super happy. Take a bunch of pictures. It's not perfection, it's progress. So yeah, great. Okay, just another case to throw in there. I don't know. I guess I was just love to show like real world examples, but this is our other patient, Toby. And she really wanted veneers. She wanted whiter teeth. Okay. Again, like just didn't want like that stupid, like toilet bowl looking white. And we did the moment. Okay. And so another thing I like to shout out for the moment, like if patient is unsure of shade, like have them pay for 2 moments so that way they can compare the shades, and she decided this one was too bright. This is the bleach, and so we decided to go for B1 instead. And I love to show the picture of the moment because I was just silly me with my busy schedule that I like forgot to take like a proper photo, right? She still has her glasses on, but again, just showing you the real life of the practice, but we still get it done, like, and but obviously during cementation, we had plenty of time, made sure we had our final photos. So happy, literally so happy. Okay, so as you can see, it's super simple how to submit your first case. I know you're going to be fired up after this and you want to do it. So, iPhone photos are acceptable. Offer your try on smile, scan. It comes back in about a week. There's a NEER concierge. If you don't know where your case is, I message them and they tell me, give me a tracking number. They've been really helpful. And then you order your finals. So yeah, early lessons learned. Like I said, carefully review the design proposals. In my market, I am in Las Vegas. So I guess I've learned that Las Vegas is different than everywhere else in the world, but people really always like brighter. So if they're uncertain between the colors, I always convince them to go lighter, especially because the veneers are translucent. They're about 0.3 millimeters. And so even the bleach shade isn't looking toilet bowl because the natural tooth underneath is going to shine through. And so if the patient is dark underneath, always recommend whitening as well. It's going to give them that better result. Okay. And I know some doctors aren't into the colored cements. I am, again, just because I know sometimes patients do want that super, super bright. So VarioLink Light or Light Plus. Always start with the easier cases, take lots of photos. I love sports documentaries. Tom Brady is like my icon. And, we're always big on, like they watch their film. That's what we got to do. You take the photos. Trust me, I overthink everything. I stared at the photos. I questioned myself, and confidence doesn't come before the first case. It comes after the first case, after the second, after the third. Okay. And so just, know that that's going to take that time. And so just do it. And so at this point, we've talked about case selection, patient conversations, try-ons, bondings, and delivery. So now, how are you actually going to make this part of your practice? And so it's about the systems. So in my practice, you have to like at your next team meeting, at your next huddle, make sure everyone knows that this exists. Okay. Print it out, show them your befores and afters. Okay. Amp up your hygienists, okay? Let them know that they need to listen for those cosmetic points. I tell them too, because when they're like, hey doc, patient like wants whiter teeth, they chip their tooth. Oh, they want to talk about NEER. They saw the signs in the waiting room. Can you see them? The answer is always yes. Yes, I'm gonna pop in right now. We're going to do it, okay? But they're gonna listen out for the gaps, the worn down teeth. I wish my teeth were whiter. Because they're going to be helping you as well. We need to do photos. Again, iPhone is great. Having a clear pricing and financial conversation. So just knowing like, okay, that for me, I like to keep it simple, like, and for you, so the bare minimum you should charge someone is 5,000. So you want to find your first patient, tell them $5,000 for 10 prepless veneers. You're running a special. You're building your portfolio. And again, you let them know that $5,000 special comes with a catch that you need to be able to use all their befores and afters for your marketing, okay, for your portfolio. And so, and then let them know that they have financial options, okay? And even start with the moment. Every doctor is a little bit different, whether we're going to, some people include it in their case fee. I always charge for the moments. And then, as I mentioned, just scheduling appropriately. Okay. It's been a game changer. In the first few months of me even doing NEER, I've added over $200,000 to just my cosmetic line. And it's not just about NEER, because not everyone's a candidate for NEER. The beauty about cosmetic dentistry is once you start doing cosmetic dentistry, you do more dentistry because you need to treat the decay, treat the perio, to do even the cosmetic, or they're not a NEER case, right? And then next thing you know, it's a full mouth case, and or they want the full porcelain, right? And so you're doing the GP aligner deliveries first before you even do the NEERs. So it really helps you be so comprehensive, and it makes it super exciting. So yeah. Anyway, QR code for your first moment. It's Patrick, do you want to talk about this? Buy 5. And if you don't convert, you get
Yeah.
your money back.
Yeah, absolutely. I'd love to talk about this. So we have a bit of a deal going on. for a little while longer, where if you buy a 5 pack of Moment, which normally is $125 a case, it's essentially buying 4 Moments, getting one free, and you are a brand new doctor, haven't done NEER in your practice yet. The deal is essentially is if you don't convert a case from those 5 Moments in 90 days, you'll get your money back. We have seen Moment work really well in practices, especially when you're offering it to potential candidates. And so we really believe that it would help you convert, and we want to stand behind that and put our money where our mouth is, so to speak. So if you scan that QR code, you'll be able to book a demo and get converted on that. If you're already a NEER provider and have done a NEER case, you can get the same deal just without the guarantee because you're already closing cases. So yeah, it's a great way to start, especially if you're new to the world of like no prep and prepless and 3D printing and all of that. This is a way for you to experience the material and see what's possible with patients. And plus, if a staff member has it, it's a pretty cool like trick to show patients where they can just pop in the teeth and take them out right there in front of them.
Yay. And so without further ado, I mean, happy to answer any questions that you have. And then you can book a demo with your local rep and learn about how to get started. So,
Yeah, we actually have a couple of questions. We can leave this up here on the screen. So the first question comes from an anonymous attendee. Are peg laterals with enough interproximal spaces good options for no prep near cases?
yes, I don't see why not. A couple of things I just get concerned about is how much space do you have? Because veneer, anything prepless, doesn't completely wrap on the lingual. So you just don't want to create like this shelf where things are getting stuck behind and then creates um like food traps or in like a honestly a case for developing caries and things like that. So again, for me it's always when in doubt, do the Moment, see how much you actually can like fill. And just and again, it's ultimately the conversation that you have with your patient. If they are okay with the ledge that they're going to have, because it's going to be an opening on that lingual aspect, from a hygiene perspective. Yeah.
Great. Another question here is, do you cement all the veneers at the same time? I think you actually covered this in your bonding protocol, but maybe
Yes.
just, yeah, revisit
Yeah,
it.
I do. Whenever possible, I try to cement all the veneers at the same time just because it's already stressful and I just want to get over it. I'm like, let's just be done with it. But like I said, I mean, um, and also, I will tell you this, because once you cement, like, and I've done it multiple ways. Like, let's say the gums start bleeding, or I have a veneer that's like floating and it's like doesn't have a really great like occlusal stop or anything like that. I'm like, oh, I need to make sure this is seated properly. So I've done it a couple different ways. And let's say I only cement like the front four or the front six. Well, then you actually have to make sure that you try in the other veneers before you cement it, because sometimes the veneer shifts a little bit and next thing you know, now those other veneers don't sit and you have to do like adjust the contacts or whatever it is, and so then it creates like a longer process for me. But again, if the situation isn't ideal, I have done it in segments, but always check after the initial bonding of the first set.
Awesome. And then kind of we had a couple of questions around this. I'm gonna group it all and lump it all into one. When it comes to charging patients for Moment, how do you typically address that?
Yeah, I just charge the patient for the Moment. I tell them it's $125 for the try on. It's no risk. We're gonna take scans of your teeth, a photo of your teeth, and then we can take a look and see, do we like it? It's a conversation starter. Okay, we bring them back and then we can look, do we like the length? Do we like the color? Do you want to proceed with NEER? Do you want to proceed with porcelain? And so for me, I charge the patient and I only charge them the lab fee. Okay. It's up to you though. I mean, now that I'm saying that out loud, I'm like, I should probably charge them more, because what about my consult fee or the chair time for that? So, but I also understand then to not making it too cost prohibitive that the patient's like, oh, that's like, I'm investing $500 and I don't even get anything. I'll tell you some other ways doctors have done it. Let's say you do charge them $200. Then some doctors say, well, that $200 can go towards your $7,000 veneer case. I know some doctors have said they've done it for free, but I don't like that at all.
Awesome. I have a question here that I will take. The question is there bulk pricing on NEERs? Meaning, can you pre-purchase some credits at a discount? If you scan that QR code and book a demo with a sales rep, many of our sales reps are willing and able to make a deal with you that works out. We have another question from a doctor here. Just to confirm, NEERs can't be done on teeth with existing interproximal restorations like anterior composites.
Okay, that's going to be up to you and your risk tolerance. And so there are doctors who are putting NEERs on like an existing crown, existing implant crown, existing restorations. That's not my preferred, okay? Just because we know that bond strength is going to be at its most when it's bonded to enamel. So I would just say a couple things to consider would just be how much of the facial surface area is a composite, you know? Also, how old is the composite? Is there recurrent decay? Are you going to replace that composite? If you are going to replace the composite, again, charge the patient for that service and the NEER because they're two separate services. So it's totally up to you. I would feel comfortable, and I have when it's, I would say, like less than like 10% or less of the surface area, because then I have like 90% rest enamel to bond to. But it's up to you to case by case. And again, utilize the group chat to, talk about it, because maybe other doctors have different experiences.
Thank you. We got one here. It's related to interproximals. I saw interproximal. You could not extend the NEER and showing the color difference. How do you handle this issue?
Sorry, one more time.
Yeah, I'm struggling too. I saw the interproximal. You could not extend the NEER.
Oh, this
And
one,
yep,
probably.
yeah. And
No,
showing,
I would say, okay, so this is actually a really, really, really great photo. And that you bring up a very good point. I think this goes back to my early mistake made. I should have done a better job looking at this. What I did, I actually had requested a revision from the lab. I said I wanted them to tuck the margin deeper. So they did. Okay, so that's was my own mistake. But I would say too, for some doctors, they would have cemented this. And what they do is once this NEER is cemented and bonded to the tooth, this demarcation becomes a gradual. It actually, there's this become one effect. Dr. Kong talks about it in one of her videos too. But after bonded, like the margin now starts to become a blended and becomes one with the enamel surface, and it actually creates warmth. So if patients don't want that like super fake looking, you know, I have veneers look, some doctors actually like this. I've learned. I don't. But again, it's just a preference thing. So just pay attention to the design proposal. Look out for this, because if you don't want it, then ask it to be tucked. And I do that for all of mine. I make sure that the margin you can't see like that interproximally. So yeah, good question.
yep. Another one is, could you please repeat the areas that you typically polish and prep to avoid veneer fracture?
Yes, for sure. I have this going back to that slide or not. Oh, here it is. Okay. Okay. So actually, this is a really great one, but it's going to be the distal of the central. So 8 and 9, like the distal facial line angles, the facial prominence of the canines. And honestly, like I find sometimes like 7 and 10 too, if they're like a little rotated, like that mesial facial line angle. So this is just another photo of like where the arrows are, right? So you see the canines, the distal of the central. So just to point out, like this patient's central incisors are like trapezoidal, right? Or like bulbous wide. And so, that in itself is also going to create almost like an undercut, or making like the tooth look even more like wide and bulky. And so my goal here is to try to make that distal facial line angle of number 9 look almost more rectangular rather than trapezoidal. Hopefully that makes sense. But yeah, good.
Yeah. Got a couple of product questions that I will kind of quickly run through here. First question is, are NEERs layered zirconia? No, NEERs are a 3D printed nano ceramic hybrid material. We 3D print them. That allows us to get super, super thin in some cases, although we really don't recommend it, especially for your first case. We can get down to 0.2 millimeters thick. Most cases, the safe area is around like zero point 0.3 to zero point 0.4 millimeters, especially for your first case when you're just getting used to patient selection, bonding, things like that. Um, do NEERs fracture? I'll answer this one as actually a NEER patient myself who's had NEER in his mouth for over a year now. Yes, they do. NEERs can fracture. This is patient selection. This is patient coaching. Normal veneers can fracture and debond and things like that if your patients are not taking care of their teeth, if they're not keeping up with oral hygiene, if they're not wearing a night guard, if they are chewing on things that they shouldn't or using their teeth as tools, right? If they chip their tooth because they opened a beer bottle, this is probably not a good candidate for NEER, right? Unless we can correct that behavior. So it really comes down to what the patient is, what the smile is, things like that. If you ever have questions, especially with a Bruxer or anything like that, drop it in the chat. But like any cosmetic restoration, these are not, some bulletproof adamantium that we're putting in a patient's mouth, right? Like any cosmetic restoration out there, there are risks, and a patient should take care of their teeth accordingly. Um, Another question is, how white can you get? I ordered a moment in bleach. Patient was okay with the fullness, but wants whiter. His natural shade is already B1. Bleach is as white as we go. Maybe Dr. Velayo, you can talk about like how you use like shaded cements and things like that.
Yeah, just going back to that other question real quick though, too. It's like I think from a framing perspective, you can make the patient feel excited though. It's like I've designed the like the nears are going to break first before your tooth breaks, you know? So because that way it gives yourself even a little bit of wiggle room if and when it does fracture, it's like it's an easy process, if it needs to be replaced, we can order a backup set and replace it for you. So just so you're preparing the patients for things that can happen rather than defending yourself when something does break. Or I have had a fracture. I've had a fracture on like a canine or a premolar. I asked the patient if he was wearing his night guard. He said no. But the beauty of the material, and I've done a couple different things. The beauty of the material is because it is partially resin. It's actually easy to repair with composite. So that was actually the quickest thing. The patient travels a lot, couldn't wait for me to order another backup set. So I just patched it up with composite and haven't had an issue since. And I took down the occlusion over there. So I think occlusion is a really big thing and just making sure the patients wear their night guards. In terms of again, bleach is the brightest shade. I mean, if the patient can whiten more, or like I said, play around with tinted cements then.
Yeah. Another type of product question: how does Moment work? Is it 3D printed in house? Moment works the exact same way as NEER. We 3D print it at our lab. Now, there's an option for you to download it and print it yourself. It won't be with our material. However, we do have a friendly relationship with Sprint Ray, so we can help get you closer to what we're doing. With NEER, the benefit of using us is you don't have to fuss with any of this stuff. Like we take the workload, the polishing, the prepping, finalizing, all of that stuff off of your plate. If you love 3D printing, we love that too. I encourage you to talk to one of our reps, and we can make things happen for you. I saw a note that the QR code doesn't work. I'll make sure when I send a follow-up email that I'll include all the links to the WhatsApp community, finding a local sales rep, and the Moment. Make sure that everybody has access to everything. Um, Oh, here's a good one. When the Moment is see-through, does that mean that you need to do enamelplasty?
I would. Exactly. Because that means like one of two things. If the moment is super see-through and should take a Bowley gauge so you can actually measure it, like if it's less than zero point 0.3 millimeters, like either you ask the lab to make it thicker in the area. Do you want it thicker? Because also if it's thinner too, like are you going to have a uniform distribution of cement underneath? You can get high spots. I've had that too, and it doesn't look as cute anymore. So then I would reduce a little bit. And then that way, then you're going to have that even thickness of the NEER material all around. So again, that's the beauty of Moment. It's going to help guide you. Do I like what I see? Do I need to make any adjustments? Do I need to warn the patient of anything ahead of time? So really good question.
Yeah. And a few other questions kind of around Moment. We've had people ask if it's a snap-on smile or if it's individual or all attached. Moment is the same design files that we're using for veneers. What the designers are working on is they'll actually design the veneers first and then connect all of those veneers for our 3D printer. So it comes as a snap-on smile, just way better. A lot more aesthetic, looks a lot more lifelike, natural, has natural translucency, isn't super opaque like what we see from some other products out there. Um, a couple of questions. One question is, how do you charge for a repair? Like, do you do a warranty? How do you structure that in your practice?
Yeah, good question. Okay, let me see if um I'm a little soft, I'm not gonna lie, because trying to think back of the repairs that I've done. No, I haven't charged for a repair, and that's just me. But I would say it's how much does it cost for a new set? Or like
For
another.
a replacement set, a full replacement set is $250.
Okay. So, and I think the reason I haven't charged was that was also my mistake in the beginning, right? And so now I build into all my consults, right? Because we always have to set that expectation. We need to know that the NEER is not it's that middle ground, right? It's way stronger than composite, not as strong as porcelain or zirconia. And so talking about lifespan, durability, things like that, and or even like their own responsibility of maintaining it. If are you wearing your night guard? If you don't take care of it, are you coming in for your checkups? And so you can just let them know up front. The beauty of the material is that it's easy to repair, and if it breaks, depending on the extent of the fracture, we can always order another set or a backup pair. It's $250. You know, Anytime that something needs to be done, I always just tell the patient, like, the fee up front like that. And so now they know moving forward. I haven't, since I've started telling them about that, I haven't had to replace any, so I haven't charged any. The only ones that I repaired was just like my first case too. So I'm learning with them at that time.
Nice. We had one person which had an interesting request, which I just want to call out. Can we do a webinar to go over how to patch with composite if a near breaks, like the steps, if you would rough and bevel the near? I don't know. Maybe this is something live where we should chip one of mine or damage one of mine and patch it.
No, but believe it or not, I mean, okay, I have patched it and I didn't do anything fancy. I really just treated it like a regular composite. I mean, bond and then fill. But if you have an intraoral sandblaster, you can do that too. But you think about it, like I'm most likely, if I'm bonding to the enamel, then I'll etch the enamel. If it's just truly like the porcelain that I'm adding or the NEER that I'm adding to, then I'm just treating it like another porcelain resin case that I'm just trying to add stuff to. So, but yeah, I mean, if you want to do another webinar of that, I think it's just quite simple. It's something that we do every day. Yeah, so don't overthink it. Just treat it like another filling that a class 5 that pro or class 3 that you have to fix.
Yeah. So having access to our clinical lounge, you'll have access to, we host study clubs. So virtual study clubs, this is a great time to like bring those types of questions. Our clinical trainer, Heather Livesey, runs those, which is really nice. One last question, and then we'll wrap up here. sandblasting interorally, do you find that gums bleed during that process?
Not if I try to angle it not towards the gums, and I know it's a really whole very technique sensitive process. So no, but yeah, I haven't actually had that problem. I'm also new to the sandblasting, but the ones that I've done, I haven't had a problem. Fun fact, I don't want to even advertise this, but I'm just saying because I like the first case I did was not sandblasted either, and I mean it's still holding on to.
Yep.
But I'm really so excited about all this engagement. Definitely connect with me on the NEER WhatsApp group chat. Follow me on Instagram, DM me. Happy to answer any questions and be a resource for you. Again, for me, I'm like all about, like I said, progress, not perfection, and just giving you that like real life, everyday example. Like if I can do it, I feel like you can do it too. So hopefully this was good for you. Thank you.
Thank you, everybody.